Emily, we so welcome you to be with us. And probably there's no greater think tank around than the American Family. And so we welcome you to help us think this through this morning.
Thank you very much, Peggy. It's a pleasure to be here today. As Peggy mentioned, my name is Emily Feinstein, and I'm the Senior Policy Analyst here at Casa Columbia. I've spent the past 4 years focused on issues related to teen smoking, drinking, and other drug use. And today we're going to focus on why teen substance use is such a critical public health problem, and importantly, what parents and other adults in teens' lives can do to prevent it. Now, the blue sections in this scan show the maturing parts of the brain. And as you'll see, the maturation process begins at the rear of the brain and works its way forward through adolescence into adulthood. And the front of the brain is the last to develop. This is the prefrontal cortex. The prefrontal cortex is very important for executive function. It's the term that we use for judgment, decision making, appreciating long-term consequences, and impulse control. And as you see, that part of the brain develops nearly last. This fantastic ad from Allstate sums it up. Why do 16-year-olds drive like they're missing a part of their brain? Because they are. As we saw in the last slide, the prefrontal cortex is still developing in teens. And because the prefrontal cortex governs judgment, understanding consequences, and impulse control, teens are more inclined to taking risks, including the risk of experimenting with addictive substances. So this period is sort of what we call a perfect storm. During adolescence, because the brain is developing, teens are more inclined to taking risk. But at the same time, because the brain is developing, it's more vulnerable to the damaging effects of addictive substances. So this makes teens at increased risk of becoming addicted when they use. The epidemiological evidence shows that there's a strong link between age of first use and suffering from the disease of addiction. 90% of individuals with this disease began smoking, drinking, or using other drugs before the age of 18. It's really important here for me to note that it's not just people who suffer from alcoholism began drinking before age of 18. All substances affect the brain in similar ways. They all affect the reward pathways and increase dopamine in the brain. The use of any one of nicotine, alcohol, or other drugs increases the likelihood of use of other drugs and increases the likelihood of addiction to any of these other drugs. And here you see some data that shows that the earlier teens begin to use, the greater the likelihood of addiction. And the converse is also true, and this is very important for parents to understand. Every year that first use is prevented and delayed, the risk of addiction goes down. So here you see our data which shows that individuals who first use tobacco, alcohol, or other drugs before the age of 15 are 6.5 times as likely to have addiction as those who first used at age 21 or older. How big is this problem? Well, when we looked at high school students, we found that 75% have already used one or more addictive substances before they graduate. This includes here tobacco, alcohol, marijuana, and cocaine. And 46%, nearly half, have used one or more in the last 30 days. We call these current users. So what drugs are teens using? Well, by and large, the number one is always alcohol, with about 72% of high school students having ever used it and 40% having used it in the last 30 days. Cigarettes and marijuana are second, and we see that the lifetime rate of cigarette is still higher, but when we look at marijuana use, and this data is a little bit old, we're seeing it even more today. More teens are current users of marijuana than of cigarettes. The consequences of adolescent substance use include serious academic, health, and social consequences. I'm going to talk a little bit more about academic and health consequences, but on this slide, I just want to point out that teen substance use is associated with risky sexual activity, which includes unprotected sex and multiple sex partners, and can result in sexually transmitted diseases and unplanned pregnancies. It also puts teens, especially alcohol, at risk for sexual assault. Teen substance use is particularly associated with academic consequences, and here I want to point out it's not just poorer grades, which it is, but also increased likelihood of dropping out of high school, decreased likelihood of graduating from college, and there's evidence that shows that teen substance use, especially use of illicit drugs, is associated with long-term career effects, including increased likelihood of unemployment, decreased benefits, and career advancement. So what is driving this problem? Well, as I mentioned, American culture is rife with messages that promote teen substance use. These messages are coming from the family, the home, the school, the environment, the media, other teens. But for the most part, these messages are created by adults. The first place where teens receive mixed messages about substance use is the home. Parents themselves send mixed messages with their beliefs and their behaviors. So, for example, we found that almost half of high school students live in a household with a risky user. A risky user is somebody who smokes or uses tobacco, drinks in excess of the US dietary guidelines for safe alcohol use, or uses controlled prescription drugs to get high, misuses them, or uses illicit drugs. In addition, in our survey, when we talked to parents, we found that 1 in 5 parents think marijuana is a harmless drug. And last, it's worth noting that one of the primary sources for these substances for teens is home. Another source of these mixed messages is the school environment. In our teen survey this year, 60% of high school students told us that drugs are used, kept, or sold on their school grounds. Lack of funding, lack of evidence-based prevention programs, and a failure to look at this as a healthcare problem really lead schools to miss an opportunity here for prevention and early intervention. Every day, teens are bombarded with messages from the media that make smoking, drinking, and drug use seem glamorous and relaxing. I mean, look at this Cuervo ad. Who doesn't want to be those people in that ad, especially if you're a teen? So what can parents do? Prevent, delay, but how? Well, the key to preventing teen substance use and raising healthy drug-free kids is parental engagement. At CASA, parental engagement is a term that we use for a cluster of parenting practices and norms that the research has identified as being associated with the reduced risk of teen substance use. First, let's talk about being there. What does being there mean? Well, first of all, monitor your children's TV shows, movies, games, and music. As we talked about, the media is a really big influence on teens. It's important to monitor what your children are watching, set limits, and certainly talk to your kids about what they're seeing. Secondly, monitoring your children involves knowing how they're doing. How are they doing in school? How are they doing emotionally? When you see signs of depression or anxiety, it's important to get help that they need right away. And last, just simply being involved in your kid's life and knowing what's going on and being a source for your teens of advice. Well, all around you, you're going to see what we call teachable moments. These are opportunities from things that you see in the media or walking down the street. Maybe someone smoking a cigarette, maybe someone at a dinner party drinking too much. Maybe it's just Lindsay Lohan in the news again. These are opportunities to start a conversation with your teen. What do you think about that? Do you see this going on at your school? Why do you think people do this? What do you think it does to the teen brain? And have a real conversation. The last point, which I'm going to pull up here, is really remember that communication is half listening. It's really important for teens to feel that their parents listen to them. Set rules and expect your children to follow them. You know, children aren't born knowing limits. This is something that they learn through trial and experience, and it's really important for parents to teach them this by setting sort of a safe scaffolding around them and allowing them to push a little bit, but having firm limits on acceptable behavior. You do this by explaining what the rules are, explaining what the consequences are when children break the rules, and then enforcing them. The message here really for parents is to be a parent and not a pal. Another important thing to know is that teens really don't want to disappoint their parents, and so your expectations are very influential. When we ask teens how upset their parents would be to learn that they'd smoked, drank, or used marijuana, most teens say their parents would be extremely upset. And these teens who say their parents would be extremely upset are also less likely to have smoked, drunk, or used marijuana themselves. We found that teens who attend religious services at least 4 times a month are less likely to be smoking, drinking, and using other drugs. The other wonderful opportunity for parental engagement is family dinners. Our research has consistently found that family dinners are associated with a decreased likelihood that teens are smoking, drinking, and using other drugs. The family dinner, this is the perfect opportunity to get in touch with your kids, to be there, to know what's going on in their lives, to talk to them about school, to have these teachable moment conversations, and generally foster a strong supportive environment with your kids. When we ask teens about their thoughts on family dinner, teens by and large always tell us that they love it, they appreciate it, they wish they could do it more, and the thing that they value is not the food, but the conversation that happens around the table.
it's fabulous to hear your research and to hear all the things you've done about it. And when I think about Family Day and eating dinner together is just phenomenal. This September 24th, and you have all of those people across America eating dinner. I mean, what are some of the tips that you say to parents?
Some of the tips we have include ways to involve children in the family meal, so ways to help get them involved in making dinner or choosing the menu. Other tips are about conversation starters, ways to get the conversation started. Really ideally at Family Day, we want parents to be connecting with their kids, getting engaged and learning more about what's going on in their lives. So we have tips for how to make this fun and easy for parents.
It looks like we're coming to the end of this, and I would like to add thank you again, Emily, for the research. Thank you, Casa. We really appreciate it.